If you're an older adult with diabetes or care for someone who is, there's a common mistake you might be making without realizing it, which could be putting your feet at risk every day. This mistake, as simple as it is dangerous, is underestimating small wounds or discomfort in your feet. You might think that a small blister or slight irritation isn't something to worry about, but let me tell you, this neglect is the main reason why many people with diabetes end up facing the devastating reality of amputation. That's why I'm going to show you how to avoid this fatal error and what actions you can take today to protect yourself from one of the most serious complications of diabetes. What you'll learn here could not only save you from amputation, but also give you peace of mind knowing you're doing everything possible to take care of your health. Uncontrolled diabetes damages blood vessels and nerves, especially in the extremities. This can lead to poor circulation and loss of sensation, making injuries, infections, or foot ulcers go unnoticed until it's too late. A simple wound can turn into a severe infection, which in extreme cases may require amputation. To put this in context, according to the International Diabetes Federation, people with diabetes are up to 25 times more likely to suffer an amputation than those without the disease. Older adults are particularly at risk due to the combination of diabetes with other health conditions like arteriosclerosis and diabetic neuropathy. First, monitoring blood glucose levels. Keeping glucose levels under control is crucial to preventing complications in older adults with diabetes. Chronically high blood sugar can damage blood vessels and nerves, increasing the risk of serious problems like foot ulcers that can lead to amputation. This is why regular glucose monitoring is a cornerstone of diabetes management. Controlling glucose levels not only helps keep diabetes in check, but also prevents fluctuations that could trigger immediate or long-term complications. Hyperglycemic episodes can progressively damage blood vessels, while hypoglycemia can be dangerous in the short term, causing fainting or falls, which are particularly risky for older adults. A study published in the New England Journal of Medicine showed that patients who managed to keep their hemoglobin A1C levels, a marker of average glucose control over the past 3 months, below 7%, significantly reduced the risk of microvascular complications, including diabetic ulcers, compared to those with higher levels. This strict glucose control not only improves overall health, but is also a critical factor in preventing amputations. It's advisable for older adults with diabetes to measure their blood glucose levels at least twice a day, preferably fasting in the morning and 2 hours after a meal. This provides a more comprehensive view of how food affects blood sugar and allows adjustments in diet or medication treatment. Using an easy-to-use glucose meter is key, and it's important for patients to keep a record of their glucose levels to share with their doctor, who can adjust the treatment if necessary. Second, foot care. This is an absolute priority for older adults with diabetes, as any small injury can turn into a serious ulcer or infection that, if left untreated, could lead to amputation. Diabetic neuropathy, which is the loss of sensation in the feet, and poor circulation make even a small cut go unnoticed and become something much more serious. Older adults with diabetes need to pay special attention to their feet because the combination of neuropathy and poor circulation significantly increases the risk of developing ulcers and other complications. Neuropathy can cause a person not to feel a blister, a stone inside their shoe, or a cut, allowing an infection to develop unnoticed. Additionally, poor circulation slows down healing, further aggravating the problem. You can follow these steps for effective foot care. Number 1. Daily inspection. It's essential to check your feet every day, ideally at a routine time like before bed. It's important to look for any signs of irritation, redness, blisters, wounds, or any changes in the color or texture of the skin. Number 2. Proper hygiene and drying. Washing your feet with warm water daily helps keep the skin clean and free of bacteria. It's crucial to dry your feet well, especially between the toes, as moisture can lead to fungal infections. Number 3. Hydration and nail care. Keeping the skin on your feet moisturized with a foot-specific cream helps prevent dryness and cracking. Nails should be trimmed straight across, avoiding cutting the edges too much to prevent ingrown toenails, which can become infected if not treated properly. Number 4. Wearing appropriate footwear. It's essential to wear well-fitting, comfortable shoes that provide support. Shoes that are too tight or too loose can cause friction and injuries. Additionally, cotton socks that keep your feet dry are an excellent choice for daily use. Third, healthy diet. Proper nutrition is one of the most powerful strategies for controlling diabetes and therefore for reducing the risk of serious complications like amputation. Diet not only directly affects blood glucose levels, but also influences cardiovascular health and the body's ability to heal wounds. It's important to focus your diet on foods that help maintain stable glucose levels. This includes non-starchy vegetables like spinach, broccoli, and cucumbers, which are high in fiber and low in calories. Whole grains like oats and brown rice are also beneficial because they release glucose slowly into the bloodstream, avoiding sugar spikes. Lean proteins such as fish, skinless chicken, and legumes are essential for keeping muscles strong and supporting recovery and wound healing. An ideal meal plan for an older adult with diabetes should be varied and balanced, ensuring they get all the necessary nutrients without raising glucose levels. This includes small, frequent meals to avoid large blood sugar swings. An example could be a breakfast that includes oatmeal with berries and nuts, a lunch of salad with grilled chicken, and a dinner with salmon, quinoa, and steamed vegetables. Healthy snacks like an apple with some almond butter can also be part of a meal plan that keeps energy and sugar levels under control. Fourth, physical exercise. Regular exercise is another fundamental pillar in preventing complications related to diabetes. For older adults, exercise should be adapted to their physical capabilities, but even moderate activities can have a significant impact on improving circulation, muscle strength, and blood glucose control. For older adults with diabetes, low-impact exercises like walking, swimming, or stationary cycling are highly recommended. These exercises not only improve circulation, but also help control weight and glucose levels. Yoga and stretching exercises are also beneficial as they improve flexibility and reduce stress, which can negatively affect blood sugar levels. An effective routine could include a 20 to 30 minute walk a day at a comfortable pace, followed by gentle stretching exercises at the end of the walk to prevent muscle stiffness. For those with limited mobility, chair exercises like leg lifts or arm movements with light weights can be an excellent option to maintain physical activity without overloading the joints. Fifth, infection prevention and treatment. Infections are one of the most serious complications that can arise in older adults with diabetes, as they can progress quickly due to the combination of poor circulation and a compromised immune system. Prevention, early detection, and proper treatment of infections are vital to prevent them from becoming something more serious, like a diabetic ulcer that could lead to amputation. It's crucial that any sign of infection be treated immediately. These signs can include redness, swelling, warmth in the affected area, pain, and in more advanced cases, pus discharge. If an infection is suspected, it's crucial to seek medical attention immediately. Early treatment usually includes proper wound cleaning and the administration of antibiotics. In some cases, debridement of the wound may be necessary, which is the removal of dead or infected tissue to promote healing. Regular visits to the doctor or podiatrist are essential for preventing and treating problems before they become something more serious. It's advisable to have foot checkups at least once a year, or more frequently if you've already had complications. During these checkups, the doctor can detect problems that the patient may have overlooked, such as small ulcers or early infections. Another important aspect is that you also learn to identify the early signs of this disease. Detecting diabetes in time can make the difference between easy management and serious complications. In this video, we explain in detail the early signs of diabetes in people over 50. It will help you recognize those silent symptoms that often go unnoticed but can be key to protecting your health and maintaining your quality of life.